Hello, thank you so much for joining me today for this Medicare Medicaid Assistance Program presentation. Today, we're here to discuss taking charge so you can help prevent healthcare fraud and abuse. How many of you think that you may have been a victim of a healthcare scam? Well, by the end of this presentation, I hope that you will have learned some tips that you can use to ensure that you prevent, detect, and report fraud and abuse when it happens. Let's get started. Who we are. We are Michigan's Medicare Medicaid Assistance Program, referred to as MMAP or MAP. We are a free health benefit counseling service for senior citizens and disabled adults. Our goal is to help you find your way through the benefits maze. We are housed at area agencies on aging and other similar organizations throughout the state. Specifically, though, our MAP program is housed at the Area Agency on Aging 1B. The 1B area services the Metro Detroit counties of Oakland, Macomb, St. Clair, Washtenaw, Livingston, and Monroe. MAP is also Michigan's SMP, or Senior Medicare Patrol. We are part of a national network that empowers and assists Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. Let's learn a little more about Medicare fraud and abuse. Medicare fraud, errors, and abuse affect everyone. So, if you're a Medicare beneficiary, or a caregiver, or even a taxpayer, this affects all of you. Billions of taxpayer dollars get lost to improper claims, and Medicare trust funds then end up at risk. Medicare beneficiaries often end up paying a higher premium, they have less money for their needed benefits, and the quality of treatment can change. Medicare fraud, errors, and abuse can also cause serious personal consequences for beneficiaries, such as medical identity theft, negative health impacts, personal financial losses. Now, let's go through each of these one by one. Medical identity theft occurs when a beneficiary's Medicare number is misused, either by a provider, a supplier, or someone posing as the real beneficiary in order to receive medical care. Such Medicare numbers are considered compromised. The recently issued Medicare cards are no longer using your Social Security number as the Medicare beneficiary ID. It's now a random combination of 11 numbers and letters as shown on this sample card. However, this new Medicare number is still uniquely yours, and in the wrong hands, it can impact you directly. Medicare numbers can be replaced, unlike Social Security numbers. If they're stolen or misused, this is not an easy process and can take up to months or even years to resolve. If you're receiving health care from a fraudulent provider, this can mean the quality of the care is poor. The care is not medically necessary, or worse, the intervention is actually harmful. Also, a beneficiary may later receive improper medical treatment from legitimate providers as a result of inaccurate medical records that contain false diagnosis, records showing treatments that never occurred, misinformation about allergies, incorrect lab results. Additionally, because of inaccurate or fraudulent claims to Medicare, beneficiaries may be denied needed Medicare benefits. Some products and services have limits, and if Medicare thinks that such products and services were already provided, they will deny payment. There's also personal financial losses. Medicare fraud, errors, and abuse can all result in higher out of pocket costs for beneficiaries, such as copayments for healthcare services that were never provided, or were excessive, or were medically unnecessary. Beneficiaries may also find themselves stuck with bills for services from providers who should have billed Medicare, but instead billed the beneficiary for the entire cost of that service. Keep in mind that even though your new Medicare identifier, the number on your Medicare card, is no longer your Social Security number, it can also be used fraudulently to obtain goods or services and should be protected as securely as your Social Security number. Also, there may be legal and financial consequences for beneficiaries who are complicit in fraud and abuse, since participating in schemes to defraud Medicare is illegal. So, then what is Medicare fraud? Medicare fraud involves intentionally billing Medicare for services that were not received, or billing for a service at a higher rate than is actually justified. Medicare abuse, though, occurs when providers supply services or products that are not medically necessary or do not meet professional standards. This is one that you'll probably be familiar with, right? TV ads that tell you that you can get a back or a knee brace at little or no cost to you as long as you give them your Medicare number. The key words here are medically necessary. If your doctor determines it's medically necessary for you to have a brace or a wheelchair or a walker, your doctor should also direct you to a legitimate supplier for these devices, not one that you'll order sight unseen with no way of knowing if it's right for you. And your doctor should also make sure that Medicare is legitimately billed for your item. Medicare fraud and abuse are very similar and many times overlap. Here are some examples of fraud and abuse: billing for services, supplies, or equipment that were not provided, billing for excessive medical supplies that you don't need, obtaining or giving Medicare numbers for free services. Treat any offer of free services in exchange for your Medicare ID number with caution. Improper coding to obtain a higher payment, unneeded or excessive x rays and lab tests, claims for services that are not medically necessary, or using another person's Medicare number or letting someone else use your number to obtain medical care, supplies, or equipment. There can also be Medicare fraud in marketing. Plans are prohibited to contact Medicare beneficiaries in the manners listed below. They are not allowed to conduct unsolicited phone calls to beneficiaries with whom they have no prior relationship. They cannot send unsolicited emails to beneficiaries who have not agreed to receive these emails. They certainly cannot call or mail a beneficiary who has requested to opt out of receiving such communications. They cannot represent themselves as though they come from or were sent by Medicare, Social Security, or Medicaid. They cannot make an unsolicited home visit, for example, a door to door cold call sale. They cannot leave their information, such as leaflets, flyers, door hangers, or more, on someone's car or at their residence unless that beneficiary is a no show for a pre scheduled appointment. And they certainly cannot initiate a discussion about other insurance products, such as life insurance, annuities, during a visit or meeting about Medicare Part C or D. Medicare scams are a growing problem and are most likely the issue that you'll encounter as a Medicare beneficiary. Because of the easy access to information, scammers contact you by mail, phone, door to door, and other ways. Many of these salespeople are trying to sell you products that you are either not covered for or are not appropriate for your personal situation. Scams almost always involve a phone call coming to the home of a Medicare beneficiary or an email. The caller or emailer often identifies him or herself as someone from an official sounding agency, like Medicare, Social Security, the IRS, or even the bank. The caller may already even have some of the beneficiary's personal information and may ask the beneficiary to verify the information they have before moving on to the information they don't have. Beneficiaries are asked to divulge information like Social Security numbers, bank routing or checking account numbers, even a credit card number. Beneficiaries will be told that the item is free to them or that this information is needed to correct an error before their benefits get cut off. Beneficiaries may even be threatened with the loss of benefits if they don't give the information or pay something, generally with a money order or a gift card. Anyone can commit healthcare fraud. Examples of healthcare fraud for Medicare include knowingly billing for services, tests, or equipment that have not been furnished, not provided, or both. Knowingly ordering medically unnecessary items for services for patients. Knowingly billing for services at a level of complexity higher than services provided or documented in the medical records. Falsifying medical records to justify improper activities, paying for referrals of federal healthcare program beneficiaries, and billing Medicare for appointments that patients failed to keep. If you have original Medicare Parts A and B and qualify for home health care services, you should pay nothing. Costs may vary with Medicare Advantage plans. Home health care services are defined as medically necessary, skilled nursing, physical, occupational, or speech therapy. It must be ordered through a face-to-face visit from your doctor to determine that you meet the definition of homebound. And a certified Medicare home health agency must provide the care. Let's talk about the newest fraud and abuse scams in the news today. Certainly, with the current pandemic situation we're in, there are COVID-19 scams out in the community. There's also scams for genetic testing, Social Security scams, and of course, free durable medical equipment scams. COVID-19 scams can include contact tracing. A contact tracer from your state health department might call if you've been exposed to COVID-19, but scammers, they are pretending to be contact tracers too. So here's how you can spot the scammer. A real contact tracer won't ask you for money. Only scammers insist on payment by gift card, money transfer, or cryptocurrency. Your immigration status doesn't matter for contact tracing, so the real tracers won't ask. If they do, you can bet that it's a scam. Contact tracing doesn't require your bank account number or credit card number, so never share account information with anybody who contacts you asking for it. And legitimate contact tracers will never ask for your Social Security number. Never give any part of your Social Security number to anyone who contacts you. Also, don't click on a link in a text message or email. Doing so can download malware onto your device. Medicare beneficiaries shouldn't be paying for the vaccine either. You cannot pay to put your name on a list to get a test or the vaccine. You will not be solicited door to door to receive the vaccine. No one from Medicare or the health department will contact you, and no one will call you asking for information to sign you up to get the vaccine. Beneficiaries should be cautious of unsolicited requests for their Medicare or Medicaid numbers. Medicare will not call beneficiaries to offer COVID-19 related products, services, or benefit reviews. So be suspicious of any unexpected calls or visitors offering COVID-19 tests or supplies. If your personal information is compromised, it may be used in other fraud schemes. Do not respond to or open any hyperlinks in text messages about COVID-19 from unknown individuals. Ignore offers or advertisements for COVID-19 testing or treatments on social media sites. If you make an appointment for a COVID-19 test online, ensure that the location is an actual testing site. A physician or other trusted healthcare provider should be the one assessing your condition and be the one who's approving any requests for COVID-19 testing. Do not give your personal or financial information to anyone claiming to offer Health and Human Service grants related to COVID-19. Be aware of the scammers that pretend to be COVID-19 contract tracers. Legitimate tracers will never ask for Medicare numbers, financial information, or even attempt to set up a COVID-19 test or vaccine for you. If you suspect a COVID-19 healthcare fraud, report it. So, what is genetic testing fraud? Well, genetic testing fraud occurs when a Medicare beneficiary is billed for a test or screening that was not medically necessary and or was not even ordered by the beneficiary's treating physician. Some examples of genetic testing fraud include a company that's offering you a free testing without a treating physician's order and then billing Medicare. These tests go by many names, and they claim to test for many things. Some of those examples are cancer screenings, DNA screenings, hereditary cancer screenings, Parkinson's screenings, even dementia screenings. This can be done by a company that provides a test or a screening that you never requested or that you don't need. A company billing Medicare for screening services that are not covered by Medicare or for screenings that do not apply to you. A company requesting your Medicare number at a community event, like a local fair or a farmer's market. Those are considered the cheek swabs at the event. If you receive a letter in the mail or get asked about that, just say no. So what happens if Medicare denies the genetic testing claim? Well, you could be responsible for the entire cost of the test. On average, that cost is around $9,000 to $11,000. So what can you do to stop genetic testing fraud? Be sure that your doctor has assessed your condition. Although Medicare covers many genetic tests for diagnostic use, it only covers one preventative genetic test to screen for cancer. So do not give out your personal information or accept screening services from someone at a community event, a local fair, a farmer's market, a parking lot, or any other event. And always read your Medicare summary notice or explanation of benefits. The words gene analysis, molecular pathology, or laboratory may include questionable genetic testing has occurred. If you received a cheek swab or a screening that was not medically necessary, report your concerns about billing errors or possible fraud and abuse to your local senior Medicare patrol. Examples of Social Security phone scams include someone calling you or you getting a recording where they are pretending to be someone from Social Security, Medicare, or the IRS. If you receive an official letter or email that can contain your personal information, the caller or letter may claim that you've been a victim of identity theft and that you've been hacked. They may even threaten to arrest you or sue you. They often require you to purchase gift cards, send cash via wire transfer, or pay using Bitcoin or a prepaid debit card. So how do we avoid Social Security scams? Well, in most cases, Social Security will mail you a letter if there's a problem. So never pay a government fee or fine using retail gift cards, cash, internet currency, wire transfers, or prepaid debit cards. They are very difficult to trace and recover. And if you receive a call or an email that's suspicious, hang up, don't respond, and contact your senior Medicare patrol. Our number is 1-800 803-7174. And of course, when you contact us, try to have as much detail as possible of the contact. So let's take a look at what you can do. So if you've identified one of these issues, what do you do next? That's what I'm here today to tell you. Not only am I going to let you know what to look out for, but I'm letting you know how to handle it. Contact the Senior Medicare Patrol. The organization exists to help you avoid and report these problems. The Senior Medicare Patrol programs, or SMPs, help Medicare and Medicaid beneficiaries across the country prevent, detect, and report healthcare fraud. By doing so, we help preserve the integrity of the Medicare and Medicaid programs. Because this work often requires face-to-face contact to be most effective, SMPs nationwide rely on approximately 5,000 volunteers who are active each year to help in this effort. So, what can you do to take charge and help prevent Medicare fraud, errors, and abuse? I'm here to tell you how in 3 easy steps: protect, detect, and report. The first step is to protect. Protect yourself and your loved ones from Medicare fraud and abuse. Treat your Medicare and Social Security numbers and numbers like your credit card. Don't give out your Medicare number except to your doctor and other Medicare providers. Don't carry your Medicare card unless you need it. Only take it to the doctor's appointments, visits to your hospital or clinic, or trips to the pharmacy. There's no need to carry your Medicare card at all once your healthcare provider has the number on record. A very safe policy to follow is to remember, if you see a phone number on your caller ID or cell phone and you don't recognize it, you don't have to answer it. If it's someone who's really trying to reach you directly, they'll leave a message. But it could be a robocall, in which case the call will disconnect and you'll never have to deal with it. If you answer a call from an unknown number and it's a robocall, they can automatically confirm that you have a working phone number, and other scammers may try to contact you. Watch out for identity theft. Scam artists will not only use your Medicare number to defraud Medicare systems, but this is also one way that people can steal your identity. So be aware that Medicare doesn't call or visit to sell you anything. However, Medicare does now require their contractors to contact beneficiaries from time to time, so make sure that you're vigilant. Keep in mind that you don't have to talk to anyone who calls you or shows up at your door that you do not trust. Medicare contractors will understand. Do be cautious of others that are offering free medical services. If it sounds too good to be true, it probably is. So pass it on. Share this information with friends and family members who might not already know how to prevent Medicare fraud and abuse. After we protect, we must detect. Detecting Medicare fraud and abuse can be simple. Even if we do everything right, there's still a chance that we could be targeted for healthcare fraud. And there are many ways that your personal information can be used without your permission. So record your doctor visits, tests, and procedures. Always review your Medicare summary notice and explanation of benefits for mistakes. Look for 3 things on your billing statements: charges for something you didn't receive, billing for the same thing twice, and services that were not ordered by your doctor. Compare your Medicare summary notice and other statements to your list of visits, procedures, and tests. You can set up a free account at mymedicare.gov for 24-hour access to your current Medicare account. So, once we protect, detect, we must report. If you detect or suspect fraud and abuse, report it. You will protect other people from becoming victims and help to save Medicare benefits for the future. Here are the steps that you should take to report your concerns. First, If you have questions about information on your Medicare summary notice or explanation of benefits, call your provider or healthcare plan to find out if it was an error that they can correct without taking further action. If you're not satisfied with the response that you get, or you're not comfortable calling your provider or plan, gather all of the facts that you can about your situation. Make sure that you have your MSN, Medicare Summary Notice, or EOB, Explanation of Benefits, and any other supporting documentation that shows the possible fraud or abuse. Then contact us, the Senior Medicare Patrol. Please keep in mind that services provided by your Senior Medicare Patrol are free and confidential. Our number is 1-800-803-7174. So remember, you can take charge and help prevent Medicare fraud, errors, and abuse in those 3 easy steps: protect, detect, and report. And remember to take what you know and pass it on to friends and loved ones who may not be familiar with this information. So if you need to speak to your Senior Medicare Patrol, contact MAP, Michigan's Medicare Medicaid Assistance Program. You can visit us online for more information at www.smpresource.org or call us toll free at 1-800-803-7174. Your call is not only free, but it is also confidential. Thank you so much for attending our presentation today. If you have any questions, please feel free to reach out to me for further assistance. Have a wonderful day.